Hi, in this video I will talk about a twisted ankle. This was kind of a funny story because it happened to a student in one of my classes where I was teaching balance method and Master Tung Acupuncture, so it was a great opportunity to show off these techniques and how they could work. What happened in this class was that one of the students during lunchtime fell down and twisted her left ankle. If you'd like to learn more about the techniques that I show in my videos, check out the courses I have available. I have balance method acupuncture courses, both in English and in Portuguese, that you can purchase and learn about this technique. It immediately began to swell, and she had to be helped back to the class, and she was having a lot of pain, and it was very hard for her to put any kind of weight on her foot. This was a 38-year-old female, and as I told you, she twisted her ankle. It immediately began to swell up in all around this area, and she was having a lot of pain. If you want to think about affected channels, we have obviously here the gallbladder channel. We have here the bladder channel, and we might have stomach, but in that case there was almost nothing related to stomach channel. So these two were my affected channels to work with. When I treat acute injuries like this, and if there is swelling, one of the things that I always like to do is start with bleeding. So I used a pen like this one you can see now. This takes the lenses that diabetics use to test their glycemic levels, and I just do a number of punctures all around the affected area. So maybe 10, 12 punctures all around, and just let the area bleed. This is a very small amount of bleeding we're talking about, a few drops for each prick, but instantly you start seeing improvement in the patient. So as soon as I did this, the patient told me that she was feeling less pressure and less heat on her ankle, and we could actually see the swelling go down a bit. After this, we went for a balance method and Master Tung approach. So I decided to work on the opposite side hand. So if this was the left ankle, I decided to work on her right hand and wrist. And thinking about channels, as I told you, we have as affected channels gallbladder and bladder, and I decided to work with the small intestine to balance bladder, and with triple warmer to balance gallbladder. So all I did was look around this area for acupoints, and she had a few acupoints on each of the channels and actually on the space between the channels that were very painful, and I needled all of them. It ended up being 6 needles in this area, and after I've done this, again we could see the swelling go down. She told me that she felt a lot less pain already, and she could start to put her foot on the ground without as much pain. But it was still very painful. After this, I used a group of Master Tung acupuncture points called Woohoo, or the 5 tigers. It is located on the medial side of the thumb, and these points are indicated for any kind of joint swelling or pain, so very much tailor-made for this case. Woohoo is a set of 5 points. I palpated the 5 points and needled the 3 that were more sensitive to the patient. After this, we could still see the swelling going down, and now the patient said that the pain, when she was not putting weight on her foot, the pain was completely gone. When she tried to stand up, she still felt some pain, but it was already more bearable. So just to finish the treatment, I used YNSA eye point for the foot on the same side, so this time on her left side. After I did this, she could now put some weight on her foot. She could walk with a limp, but she could walk by herself, which was something that she couldn't do before. She couldn't put any kind of weight on her foot. This is a great case because, as I told you before, it illustrates that acupuncture can work not only on acute injuries, but it can work immediately after the person is injured to start recovering as soon as possible and to relieve a lot of the symptoms. This is a very cut and dry case where I used a very direct approach with balanced method and Master Tung Acupuncture. I also added a bit of bloodletting and 1 point from YNSA, but it is a very simple case, but that highlights how effective acupuncture can be in a very acute case like this, immediately after the person sustained the injury. So if you work with athletes, if maybe you're connected to some kind of sports team, you can and should apply the balance method and Master Tung Acupuncture on your athletes, even if it's on game day or even if it's during practice, because we can get some amazing results using these techniques. Thank you so much for watching this video. I hope you liked it. If you like the kind of content that I post, don't forget to like and subscribe, and also share it with your friends so they can see how acupuncture can help them too.